If you or someone you love has lung disease, you know it can be debilitating. When the lungs can't get enough oxygen, living a normal life is impossible. At the Lung Institute in Tampa, patients are getting their lives back thanks to stem cell therapy. Joining us now are Dr. Burton Feinerman from the Lung Institute and his patient Hal Thiessen, who received stem cell therapy at the Lung Institute. Gentlemen, good to have you both here.
Yeah.
Okay.
Dr. Feinerman, let's start with what kind of lung diseases you deal with at the Lung Institute.
We primarily treat COPD, chronic obstructive pulmonary disease, emphysema, and pulmonary fibrosis.
And are you seeing a lot of people coming in with these conditions?
Well, I mean, actually, there's a pool of millions of people out there, of course, and once they learn about the stem cell treatments, they do call us. A lot of these people have been given, in many cases, a death sentence. And where the doctors have just simply said, well, you're getting the most we can do for you. And patients, the biggest radical thing that is going on is that patients are taking control of their own health. And when the doctor says something like them, they say, heck, I want to go to the internet or whatever source, and I want to see what's out there.
What else is out there? Well, Hal, let's talk about you. What kind of condition did you have, and what were your prior physicians doing to help you?
Well, I had COPD, and they probably did all they could do. They prescribed the medication, and I was going to doctors, and it seemed like the frequency was increasing, and they could treat the symptoms.
Right. So you were on pills?
Yeah, well, pills, inhalers, and what have you, and then once in a while they'd give steroids, which is a Band-Aid.
Right, right.
And but it changed
when you went to see
Yes.
Dr. Feinerman here. Well,
Yeah.
let's talk about what you do differently at the Lung Institute. Stem cell therapy. How do you do this?
We can isolate stem cells out either from the patient's own peripheral blood, or in Hal's case, we did it from the adipose fat tissue in the lower abdomen, which gives us a much higher yield of mesenchymal stem cells. And we administer these stem cells both intravenously and by a deep pressure nebulizer. And this type of treatment is given over a 3-day period of time. We have other things that we use that are given by nebulizer, like glutathione and transretinoic acid, that help in the repair of the damaged lung tissue. And various other agents that are given by injection to help in the repair and regeneration of the tissue. The whole idea is that it's not only to try to repair the damaged lung, but we actually regenerate these mesenchymal stem cells, turn into lung cells over a period of several weeks or months, and function as new healthy cells.
Hal, how's it been since you had this treatment?
It's been great. I mean, like I said, the opposite happened. The frequency now goes down of doctors or medication, and
so your life basically
life just gets better.
Has been totally changed.
Yes, it has.
That is so
great. It's exceeded the expectations. I went into it with a positive thinking. I was real enthusiastic about it. I believe in that.
Well, it worked. You're living proof, Dr.
Yes.
Burton Feinerman from the Lung Institute and Hal Thiessen. Thank you both. LungInstitute.com is the website. 1-855-381-COPD is the number. 855-381-2673. We'll be right back with more Daytime.